Colorectal cancer is an oncological disease. Look at this picture, shows that in large intestine, colon, CT findings, MRI and PET findings. Look at these pictures. Detail going on. Introduction. Colorectal cancer, often refers to as colon cancer, is a type of cancer that begins in the colon or rectum. It is the third most common cancer worldwide and leading cause of cancer-related deaths. Early detection and treatment are critical to improving outcomes. Definition. Colorectal cancer is defined as the uncontrolled growth of abnormal cells in the colon or rectum. This cancer typically begins as a polyp, a small growth on the inner lining of the colon, which can develop into cancer over time. Types. 1. Adenocarcinomas. The most common type originating from the mucus producing glandular cells lining and colon and rectum. Second, carcinoid tumors starts in the hormone producing cells of the intestine. Three, gastrointestinal stromal tumors, GISTs, begins in specialized cells in the walls of the gastrointestinal tract. 4. Lymphomas, cancers of the immune system that can start in the colon or rectum. 5. Sarcomas, starts in the blood vessels, muscle layers or connective tissues of the colon and rectum. Causes. The exact cause of colorectal cancer is unknown, but several factors can contribute to its development, including 1. Genetic mutations, inherited or acquired. Mutations in specific genes can increase the risk. 2. Lifestyle factors, diets high in red or processed meats, low physical activity, obesity, smoking, and heavy alcohol use. Risk factors. 1. Age. Most cases occur in people over 50. 2. Family history. Having relatives with colorectal cancer increases risk. 3. Personal history. The history of polyps or inflammatory bowel diseases increases risk. 4. Diet. High fat, low fiber diets are linked to increased risk. 5. Lifestyle. Secondary lifestyle, obesity, smoking and alcohol use. Complications. 1. Bowel obstruction. Tumors can block the intestines. Second, metastasis. Cancer can spread to other parts of the body, such as the liver and lungs. 3. Bleeding. Tumors can cause bleeding in the intestines. 4. Anemia. Chronic bleeding can lead to iron deficiency anemia. Pathophysiology. Colorectal cancer typically develops over many years, starting as benign polyps that can gradually transform into malignant tumors. Genetic mutation play a critical role in this transformation. The adenoma carcinoma sequence describes the stepwise progression from normal epithelium to adenomatous polyps to invasive cancer. Signs and symptoms. 1. Changes in bowel habits, diarrhea, constipation, or change in stool consistency. 2. Rectal bleeding or blood in the stool can be bright red or dark. 2. Persistent abdominal discomfort, cramping, gas or pain. 3. Weakness or fatigue, often due to anemia. 4. Unexplained weight loss. Diagnosis. 1. Screening test, colonoscopy, sigmoidoscopy, and facial occult blood tests. 2. Imaging test, CT, colonography, MRI, PET scans. 3. Biopsy, tissue samples taken during colonoscopy are examined for cancer cells. Nursing diagnosis. 1. Risk for infection related to compromised immune function secondary to chemotherapy. 2. Imbalanced nutrition less than body requirements related to reduced intake and increased metabolic demands. 3. Acute pain related to the disease process and surgical interventions. 4. Anxiety related to diagnosis, treatment, and prognosis. Management and treatment. 1. Surgery. Primary treatment for localized cancer involves removal of the tumor surrounding tissue. 2. Chemotherapy uses drugs to destroy cancer cells, often used after surgery. 3. Radiation therapy use high energy rays to kill cancer cells, often used for rectal cancer. 4. Targeted therapy, drugs that target specific molecules involved in cancer growth. 5. Immunotherapy boost the body's natural defenses to fight cancer. Psychosocial medicine. 1. Supportive care, emotional psychological and social support for patients and families. Second, counseling and therapy to address anxiety, depression, and stress related to cancer diagnosis and treatment. Three, support groups provide platform for patients to share experiences and coping strategies. Prevention. 1. Screening. Regular screening starting at age 50 or earlier for those with family history. Second, diet. High in fruits, vegetables, whole grains, low in red or processed meats. 3. Physical activity. Regular exercise to maintain healthy weight. 4. Avoiding tobacco and limiting alcohol reduces the risk of many cancers, including colorectal cancer. In conclusion, colorectal cancer is significant health concern, but with early detection and proper management, the prognosis can be greatly improved. Awareness of risk factors, symptoms, and the importance of regular screenings is crucial in reducing the incidence and mortality associated with this disease. Thank you. Have a good day.